Hello, everyone. Thank you so much for joining. We have a really absolutely incredible panel today. We've got people calling in from all over the world, from a range of different time zones and countries. So thank you so much, everyone, for taking the time out of your very busy days to join us for this panel. Again, we have just three remarkable speakers, global health experts, specialists, who are going to be sharing their invaluable perspectives on how we can best prevent the spread of COVID-19 across Africa and protect some of the most vulnerable communities in the world. My name is Justin Hefner. I am on the board of directors for the African Middle Eastern Leadership Project, also known as the Amel Project. And before we dive in and introduce our speakers, I was asked to give a little bit of background on the Amel Project, what it does, and how Amel has responded to this COVID-19 crisis. And so just from a personal standpoint, being involved with the Amel Project and the work that Amel does has been one of the most incredible experiences of my entire life. Getting to follow the leadership of Megan Hallahan and Mohammed Abu Bakr has really been a real honor. Megan and Mohammed have been working with some of the bravest and most inspiring young activists across Africa and the Middle East for quite some time. These are young, brilliant, energetic people who understand the risks of being an activist and yet continue to stand up for the human rights values and values of human dignity that we all share. And in 2019, we had 100 of these brave young activists from 32 different countries graduate from the Amel Institute. The Amel Institute is essentially an online university designed specially for activists by activists, with advice and guidance from professors at some of the top universities in the world. And when COVID-19 broke out, just a few months ago, and Megan and Mohammed recognized the impact that this virus could have on the continent, in vulnerable communities, especially communities in refugee camps, they realized that they had this incredible network of young people who were ready to take action. And so Amel has mobilized its vast network of young civic-minded leaders across Africa and the Middle East to combat the spread of coronavirus, and in particular, combat the spread of misinformation and to promote health best practices across the region. And so the way this has worked is these activists across 30 plus countries have been designing content, culturally sensitive content in local languages. And then Amel has been taking that content, using its Facebook platform to boost it to millions of people. And so in just the past few weeks, Amel has boosted COVID-19 prevention content to millions of people in 50 plus countries across the region in languages that include Arabic, Amharic, French, English, Shewa, and Swahili. And with your help and support, we're going to be able to reach even more people in even more languages. And part of Amel's response has been to host webinars. We've been hosting webinars with our activists, keeping them informed on the situation that's happening. And we're now expanding those webinars to include all of you that are here today, to really get a sense of understanding of what is happening on the ground and how to best protect vulnerable communities. Over the course of the next few weeks, we'll have webinars that range from protecting the vulnerable to the impact of COVID on democracy and human rights. But today's conversation with these three really incredible health specialists is going to focus primarily on innovative solutions to protect the most vulnerable communities in Africa. Thank you again all for joining. This is a really special panel. And we are joined by some incredible young leaders. So I'll begin with Dr. Shaza El-Mahdi, a Sudanese-American physician who has been advising a number of international organizations, human rights organizations, health organizations on innovative ways to best respond to this crisis. We have Dr. Obichi Obiajunwa, a Nigerian innovation expert and health specialist who has developed his own network of young leaders across Nigeria, which you'll hear a little bit about, and who's calling in right now from a village in eastern Nigeria. So thank you, Dr. Obichi, for joining us today. And finally, we have Dr. Sabera Traore, who is MD and specialist, global health specialist from Burkina Faso, who ironically finds himself in Atlanta today, which puts him in a very unique position to collaborate not just with local leaders and government officials in Burkina Faso, but also with the US CDC, which is co-located in Atlanta. And so without further ado, I'll take us to our first question. I'll essentially be, the next 30 minutes will be a moderated Q&A, and then we'll open it up to the rest of you, the audience, to ask your questions. If you've logged in through Zoom, you should have a Q&A button at the bottom of your page. You can type in your questions, and I'll do the best job possible to synthesize and ask questions that combine as many questions as possible. You can also raise your hand if that function is available, and I may be able to call on you, but for the most part, we'll use the Q&A. And so, Dr. Obichi, you're calling in right now from a village in eastern Nigeria. You're on the ground. I'm very curious if you could share a little bit more about your background, how you got to where you are, and also, what are you seeing day to day? How are people on the ground responding to this crisis?
Thank you so much, Justin. I'm very happy to be part of this panel. I'm in Nigeria, and I'm a medical doctor, a physician, public health physician, an innovation expert. I have training in medicine here back in Nigeria, and then in innovation and public health in Israel. I also did some programs back in George Washington University, a fellowship in George Washington University in the US. We've all seen COVID-19 ravaging countries, and it's also here now in Nigeria. Currently, as of yesterday, we have 981 cases of COVID-19 in Nigeria, and we already have 31 deaths so far. So it's something that is here with us. We've had high-profile politicians die from this condition. So it's a disease that people think is here with us, and we do not know really for how long it's going to be here with us. So I'm back here in Nigeria, and I have a very recent experience interacting with a very old woman yesterday. I was in a hospital in a village in Nigeria, and I was speaking with this old woman in her late 80s. I asked her, "Madam, have you heard about COVID-19, coronavirus?" She said, "Okay, is it the disease that is killing white people?" I was like, "No, this is not a disease that is killing white people. This is a disease that is persons in Nigeria." So she was like, "Okay, that she has not seen anybody that the disease has killed, nobody that she knows that is infected with this coronavirus thing that she's hearing about, and she doesn't believe that it's going to get to her village." She told me that in 1967, during the Nigerian Civil War, that as the war progressed, people were saying, "Hey, Nigeria is fighting the Biafrans." Immediately, the war was about to come into her village. The war ended. She told me that she believes that coronavirus is not going to enter her village, that before it enters her village, coronavirus as a disease will end. Now, to this old woman, she already has a belief system. She already has something she believes, and she knows it's going to work for her. She doesn't want to hear what I had to say, and she says, "You know what, coronavirus, I don't think it exists around me. I know people are suffering from coronavirus, but these people don't live around me." You see, so interacting with Nigerians, being a healthcare professional and all of that, I see about 5 kind of attitudes that people here, locals, exhibit to coronavirus, this reality we're facing currently. First is the attitude of awareness. Okay, awareness. Everybody, virtually everybody is aware there is a disease out there. Virtually everybody, all right? Why? Is because, Easter was not celebrated because of the lockdown. People are not allowed to move out to worship. Today is Ramadan, and this is a very huge festivity in the Islamic world, and they are not celebrating it in the mosques. They're not going out there to celebrate Ramadan. So when they ask, they say there is a disease out there that is killing people. That's why we should be home. All right. So everybody gets to know that there is a disease. There is this awareness, general awareness out there but it's denial. Okay, I just narrated the story of a woman I met yesterday. So she's in denial. She's still not, so convinced that this disease condition is going to come near her. She's still in denial, basically because of ignorance, illiteracy. They just get some information about this disease condition, and that is all. They don't get a lot of details about it, how to prevent it and all of that. The most they get to hear is that, okay, you have to wash your hands.
And it looks like, Abicha, if you can hear me.
Yes, please.
I was going to say you cut in and out for a second. So just to briefly summarize where we left off with you, you had talked about this experience with this woman who thought coronavirus was unique to just white people,
right.
and that this is emblematic of a lot of the ignorance that you're seeing within communities in Nigeria.
Yes. Okay. Yeah. So I was trying to categorize the levels of attitudes, the kinds of attitudes I see that Nigerians are exhibiting towards this disease condition. I said, first of all, there is this whole awareness. People are aware of the disease condition, basically because it has affected their faiths. A lot of people down here are religious. They go to church. So when they could not celebrate the Easter because they are on lockdown, they begin to ask questions. And when they ask questions, they hear that there is this disease condition that is out there that is quite infectious, that is killing people. So there is this, and today is Ramadan, okay, which is a big festivity, religious festivity amongst Muslims. They are not celebrating. With Nigeria, with more than 50% of Nigerians being Muslims, they are not celebrating, Ramadan, which is a big festival. So with these situations, social hindrances, they get to really be aware that there is a disease out there that is killing people, right? Now, that's the first level. Everybody is aware, just generally aware, and that's how far it goes. Then the next level is the level of where people are in denial. I just talked about a woman that I met, an old woman I met in the village, who thinks that this disease condition is for some other kinds of persons, that it's not going to get to her village. So she's in denial. She doesn't really believe that this thing is going to get to her village, thought more affecting her. She doesn't know anybody that is affected, neither does she know anybody that has died from this disease condition, right? So she thinks that it's just something that is not, real in her world. So that is a category of persons that are in denial. And for some of these people, it's just basically ignorance, illiteracy. They have to see it before they believe it. All right. So you have the third category of persons who are in fear. A lot of Nigerians are in fear of the unknown. The fear of the future. You have students that are back home. They don't know when they're going to graduate again because there's no end to this thing. Nobody is telling them when this pandemic is going to be over, when the lockdown is going to be released, and when they're going to go back to school. So you have people that are afraid. Their house rents are are going on, and they just have to pay the rent in a few months' time, and they're not making any income. Remember that a number of Nigerians are in the informal sector. I'm going to come to that later. But the fact is that a lot of people are in fear. Then you have another set of people that are proactive. These are people that are already taking up preventative measures, trying to prevent themselves from getting this condition. And they're really like going to take herbs, there are these herbs back in the villages that people get to take to build their immunity. And interestingly, you have, a lot of these herbs going around on WhatsApp, people circulating some of those concoctions that you have to take to prevent, yourself from getting infected. So you have this category of persons, and there's a huge population of persons that are taking, these teas of herbs every morning to prevent themselves from getting infected. Then you have also this category of persons that are panicking. Now, this is a huge one. So Nigeria today has a huge informal sector of even up to 60%. So you have just about 40% of persons that have bank accounts, okay, persons that is known by the government, so to speak. So you have this huge chunk, number of persons that live by the day's earnings. So they have to go out every day. They have to make enough money to feed. Now, these people are persons that are already, in panicking. They're already in fear. They are thinking of, how am I going to, survive the following day? How am I going to feed my, So it has raised a lot of, a ripple effect in the society, civil unrest and robbery attacks and all of those. So these are attitudes that I see that people on ground are reacting to the COVID-19.
Amazing. Wow. I mean, it's so complex, Abichi, to be in a place where people are reacting in so many different ways. I'm looking forward to getting back to you in a minute on some of the innovative solutions to handle all those different categories. But right now I want to turn it to Dr. Shaza. Shaza, I mean, you are in an incredible position where you're advising a number of different organizations on their responses. How did you come to be where you are today? And what have you seen of people's reactions on the ground, and particularly in Sudan?
Hello, Justin, and thank you for this opportunity. First of all, I have to mention that I, despite the fact that I have a medical degree and global health degree, but my approach in dealing with COVID-19 was kind of interdisciplinary approach, because I work as a consultant for some organizations, as you mentioned. Some of them, they look at the economic impact of COVID-19. Some of them are looking at the social impact. Some of them are looking, at the health impact as well. So it's kind of a little bit a holistic kind of vision. I won't be in a position to talk about the clinical aspect of it, but let me just go back and talk about what the Sudanese people in particular, how they are responding to this. First of all, we were lucky in Africa to see this pandemic coming in at the end of its, hopefully at the end of its, scenario globally, because, we lots of learning lessons to be learned from the pandemics in Europe, in Asia, and in US or Americas. For me, it's kind of learning curve for everyone. No one knows anything about this disease. We've been learning every day. The information have been flowing every day. There's something new every day. There are still unknown aspects related to this pandemic. In fact, when it comes to Africa, I feel Africa in general is in a unique position. If you look at the demographic, for example, we've learned from Europe and other countries that the elders are kind of more affected by this pandemic. The death toll is higher among people above 65 years old. Look at Africa. The median age in Africa is 19 years old. The median age in China was 38. The median age in Europe was 43 years old. This will dramatically change how this disease will manifest in our population in Africa. And I'm talking about 1.3 billions. But the other fact is that look at the situation in general in Africa. We do have other epidemics going on. Africa, unfortunately, is a land of malnutrition, is a land of other pandemics. Malaria, for example, in 2019 claimed 360,000 lives. And that's a huge lives. That's even more than what we're seeing now claimed by the pandemic, despite the fact that the coronavirus is much more of an infectious disease that is spread very quickly, as you've seen. It's very dangerous indeed, but we are going through some other dangerous stuff already. Look at the HIV epidemic in certain areas. Look at the other kind of diseases. So why those are important? Because the status of the immunity of the population will affect how this disease will manifest. We've seen those who have underlying health conditions are more affected by the coronavirus. So I'm just saying that there are like kind of other things. Look at even the way we approach treating coronavirus. It doesn't make sense to look at the situations in an optimistic way when you look at the critical care portion, for example, and you see that the critical care availability for Ugandan population is 0.1 per 100,000 population. It's like 36 in US per the same kind of population. So it's a huge variety. We don't have, even if we have the ventilator, the oxygen, in Africa, many areas we don't have the electricity. We don't have the testing kits. Look at the way we deal with the social gathering. would it be possible to compare the way the African people deal with the social gathering and the European, for example? And we've seen more than 80% increase in the number of people who goes to the let us say the religious areas like the church or the mosque, or they are more into doing this than the others. Look at the literacy rates in these countries. So I'm just saying it's not in favor of Africa in any way. That's why lots of experts were saying that we will see a devastating impact for the pandemic in Africa. And we started seeing that. I was looking at the numbers, and it seems like a country like Burundi has 20% death rate so far from the pandemic, compared to lower kind of death rates in other countries like South Africa, despite the fact that South Africa has higher numbers, obviously because they do have higher testing percentage. And this is another thing that affecting the way we deal with the pandemics as well. Again, there is no way to approach the pandemic in Africa without having the aggressive preventing measures in place. Because ideally, if the pandemic is there, we cannot deal with it. We cannot treat it. We cannot isolate people in enough medical centers. We cannot provide them with enough ventilators. We cannot provide them with enough kind of medicine that they need, not even a vaccine, and we're not yet there yet. So the best approach is basically just to focus on containment and aggressive kind of, preventative measures. In Sudan, it's the same situation. Sudan is a country that has gone through decades of civil war. We just went through a transition. Lots of things are still in kind of fragile status. The infrastructure, including the health system, is very weak. I was listening to the presentation done by the Minister of Health the other day, and he was talking about having less than 50 ICU beds reserved for coronavirus, sick people. And I'm just saying that because, we're still at the beginning. We haven't seen big rise in Sudan. We do have less than 200 cases so far. But again, the mortality rate is above 10%, which is huge compared to the globally kind of mortality rate. And you will see this everywhere in Africa, especially at the early stage when there is no kind of enough testing kits. You only see those who are in critical conditions that are coming to you, and most of them will die eventually. That's why the mortality rate is a little bit higher. One thing that is good about the young population in Africa in general is that they can take the lead in awareness. They can take the lead in filling in the gaps that an ideal government could do. And I've seen that in Sudan. They have these campaigns going on to make masks, like homemade cloth mask at home. I've seen this, some pioneers, raising money for poor people, like the street vendors, the informal sector, who is hardly hit by this pandemic. They don't have a source of income. And in Sudan, we are not in a position where the government could give a stipend or any kind of stimulus checks to the population, like what's happening in US or other countries. There is no way to replace that income coming from selling their products in the street when you are asking about being confined at home or staying at home during the pandemic. So we've seen initiatives trying to fill in these gaps. We've seen the entrepreneurship and private sector leadership jumping in, trying to provide some sort of support to divert the manufacturing lines to focus on manufacturing some sort of locally made ventilators and do more stock of oxygens and do more of stocks of PPE, the protective equipments for the medical staff. And that's great. I believe this is one of the major, the impact that is coming in these communities is huge, and it does reflect the social consciousness of those groups. I'm really inspired by what is going on, but it's still, no one could stop worrying about the situation, because ideally, actually no one knows how it's gonna be reflected in our countries and how long it takes and what we will see different than the other world, So, and I will stop here, but I will be more than happy to add more.
Of course. And thank you, Dr. Shaza. I mean, what you just said adds layers upon layers to what Dr. Obichi said, right? So Dr. Obichi took us from the different types of reactions, from ignorance to denial to panic, and then layer on top of that, right, a population that's vulnerable because of pre-existing diseases, a population that doesn't have access to ICU beds, 50 ICU beds for a country of 20 million plus. I mean, this is pretty crazy stuff, but also a little bit of hope that the young people can take initiative. So that's wonderful. And Dr. Sabere, for you as well, I think it would be great to hear a little bit about your background in all of this and how you came as well to be in a position to advise a number of different organizations on the response and what you're seeing back home in Burkina Faso.
So first of all, thank you, Justin. I would like to thank the Amel Institute for giving us this opportunity to share with this incredible audience on how Africa is addressing this pandemic. So I'm a physician, medical doctor, I'm a public health specialist from Burkina Faso. I'm a graduate from the Hebrew University of Jerusalem. I'm currently a US Fulbright scholar focusing on health policies and management at Emory University in Atlanta. I am also on the complex humanitarian emergency training with the CDC and working with them. So I'm an alumnus of the Amel Institute program on human rights. So basically, I'm working remotely. I'm remotely involved in the response in Burkina Faso at different levels, nationally and locally. So nationally, I'm working for the Ministry of Health, and so I'm trying to help in addressing this, finding solution to address this pandemic. And locally, I'm also the director of the public health department for an organization called Africa Youth Initiative for Development, AYD, which resulted from the YALI program. So Burkina Faso was one of the first countries in West Africa to be hit by this outbreak. So to date, we have around 600 confirmed cases and 41 deaths. So even though these numbers may look low, many people are at risk, as we all know. So Burkina Faso has taken many actions to reduce the spread of the disease, and as a result, to flatten the incidence curve, so the number of new cases. Among these actions, there are many actions. I would say basically the same action taken, implemented all over the world. So physical distancing, closure of schools and markets, international and national travel restrictions, and sensitization on hand washing and basic hygiene, curfews in affected cities, reinforcement of the epidemiological surveillance system, and contact cases tracking, and many others. So the country also tried to strengthen the capacities of the national laboratories in order to quickly detect the disease, because we know this is a really important part of the to address this disease, because we have to detect quickly these cases in order to find a to provide them like the appropriate care. There are also incredible efforts that are currently done to inform the population, to communicate with the communities on the disease, so that the population will be aware of the disease and adhere to the recommendation. So Dr. Obishi was saying that there's this denial of the disease. People are aware, they're not fully aware about what is really going on. There's a lot of misinformation about this disease. So communication is really an important point, and the government is like emphasizing a lot and this aspect. So in addition, we have also the civil society organization, young leaders, and everyone is very engaged and to raise awareness in the communities so that they're also aware of that. So there are many initiatives taken on the ground in order to spread the information, the right information about this disease. So of course, there will be many challenges. So challenges at national level, local level too. because there's a lack of detection kit, test kit, as we see in all countries. And if we do not have like a lot of detection test kits, we can screen people. So we have to rationate all the kits we have. And there's also this lack of ventilators for the severe respiratory cases. So it's very difficult when you have many cases, many severe cases, how you make the decision to put this one on ventilators. And I don't know if you are aware of the current prices of ventilators on the market, but the prices have like exploded. It's very, very, very expensive now. And fortunately, countries like Burkina Faso cannot afford that. So, and Dr. Shaza was mentioning the social gathering. Africa is like, there are a lot of community gatherings, and people do not necessarily understand why these measures are taken. Dr. Bishop was emphasizing on that. He was saying that, yeah, they're aware, they know that there's a disease, we don't have to meet, we don't have to. But when they don't understand that the disease is spreading, the way the disease is spreading, and so on, they won't adhere to the measure. So reinforcing the communication is really key, and this is very important. So briefly said, this is what we are doing right now to respond to the disease. Thank you.
Amazing. Thank you, Dr. Traore. And thank you everyone who's been submitting questions along the way. I'm getting your questions and reading them, and we'll synthesize and ask them in a second. These are phenomenal questions from everyone. I want to turn it back to Dr. Shaza. And everyone's touched on this a little bit, but misinformation is a major problem. Dr. Saberi just talked about it a little bit. We have some questions about it in the Q&A. You know, what, and Dr. Abici mentioned it as well with his case of someone believing it's just a white person disease. What are some strategies you're seeing to combat this misinformation? And, you know, what are your ideas around it? And you're on mute.
Yes. Well, that's a great question. Honestly, there are so many reasons to circulate the misinformation around this pandemic. The main reason is that it's new and it's so widely spread that create lots of, you know, information around it or misinformation around it. And we're still in the learning position where we learn every day, as I said earlier. The best strategy for tackling these issues is, first of all, to take a collaborative approach, which is, I've seen it happening during this pandemic. Lots of institutions around the world are coming together in a very transparent way and reflecting what they know about this pandemic. And we've seen this from the early weeks in January when China released the genome of this virus and shared it with the entire world, so that it's available for the huge industries to look at its vaccine. So they've been knowing lots about that since the very early stage. So I believe the transparency and the shared information, the collaborative approach would be really good because it does create a space where lots of experts can exchange information and transfer it to their communities. The other thing, we need to use the outlets of the media, whether it's social media or the actual media, to spread the right information. And we need to stop circulating the wrong information as well. I've seen that happening from the very early stage. I remember doing a live on my Facebook page early in March when this pandemic was claiming only a couple of hundreds of the positive cases at that time. And people were telling me, no, this is a white people, as he said, this is not affecting the Black people. We haven't seen it in Africa yet. And I've seen people talking about the temperature. This is not affecting hot temperature. Where we don't know lots of information. We cannot say it's not affecting countries under hot temperature. But what we know right now is that it is affecting those countries. To how far it can affect the countries under certain temperature, we don't know this information yet. But what we need to know is that it does affect people living in hot climate. And we've seen that in African countries as well. One of the also information that's been circulated is that there are certain disinfectant could be used, and this would bring us to the point where we really need to talk more about these kind of the behavior that we need every day, like for how long we need to keep washing our hands and what the right way to wash it. We need to wash it at least for 40 seconds and not just to do it like the way most of the people do it. We need to put the disinfectant on the surface and leave it based on the chemical component of that disinfectant. If it's alcohol based or it's based on Colorex or other things, each one has its way to do it for a certain number of minutes, and then you wipe it and things like that. We need to circulate the right information. So wiping a surface rapidly with a piece of clothes with that disinfectant might not help in killing the virus. Also, we need to know more information about the course of this disease within our body, how we interact with that, given the demographic variations. I'm thinking about recent study that was showing that maybe smokers are less to be affected or catching the virus. And that sounds odd, right? I mean, the smoking was a risk factor for so many diseases. There's no way that's unique in this. In fact, if a smoker get affected by the coronavirus, it's most likely gonna be tough on them because most of the smokers, in most of the times, especially aggressive or chronic smokers, they do have underlying illness, and that puts them in a situation that's very tough. So even if there is a study at this point, in most of the times, it's not a peer-reviewed study, and we cannot just rely on any information that asks us to loosen our precautions. I would say, well, if it is asking us to add more precaution, that's fine. But if there is a study to ask us to loosen our precaution, that's very risky at this point. We need to have more time, to spend more time and circulate that. And it is a responsibility for everyone out there not to circulate their own information, to try to search, like we do have internet now, we do have open source of media. There are trustable websites, the WHO website, the CDC website. Please go to those websites and get your information, the right information from there. And the information is available on the WHO website in many languages. It's very easy to get the information from there. And then stop getting the information from the wrong website that could jeopardize your life. Thank you.
Thanks, Shaza. And yeah, I mean, I think Amel as well is trying to address some of these things with sharing those ads that also link to the WHO and CDC pages. And so looking forward to working with you more and figuring out some of the best strategies for combating the misinformation. We have a lot of questions that have to do with lockdowns and social distancing and perhaps the negative impacts on populations, vulnerable populations. So Yassir asked about this. Mark Sepama, who is also from Burkina Faso, doing a master's in public health at Yale, writes specifically about Burkina Faso's decision to open one of the biggest markets in the country. And I know Abichi, you left Lagos just before the lockdowns. You were able to see some of the effects. So if Abichi and Dr. Saberi would address some of the issues around lockdowns, that would be great.
Okay, thank you so much, Justin. All right, so the lockdown, I've seen it in Lagos, and I'm back in the eastern part of Nigeria, and I'm seeing that we don't really have lockdown here. We have restricted movement. So generally, what I would say is that Nigeria has not really succeeded in complete lockdown, an effective lockdown, so to speak. What we have done has been to lock down businesses. People are still walking around. People are still, going about, meeting others, but they don't have to go to churches or mosques. Neither do they have to open up their businesses. And I don't think this is really as effective as it was taught back here in places like Nigeria. First is that I don't expect an economy like Nigeria to do a complete lockdown for a very long time. Well, simply because there is this huge, more than 50% of the population depend on daily earnings to live, to stay alive. I was watching the television and I saw that there is this woman, this was on social media. I saw a woman that was, lamenting, crying over the 3-year-old daughter that had measles. Now, measles, like is just a very deadly one for children. And this woman was not able to take the daughter to the hospital because of the lockdown. Okay, so eventually, if nothing is done, that child might be, lost. The child might die. And then you see that this is just one case. There are, thousands of similar situations. You have people that have malaria. You have people that are living with HIV. So you have all those conditions that are going on in Africa. So they don't have access to healthcare in this time. Even if they do have access to healthcare, they are afraid to go to their hospitals now because of this pandemic. So it's a very complicated situation. I don't think that total lockdown is the solution to this, but I think that it should give the government an opportunity to achieve certain things. Number one is to drive awareness, massive awareness, because when churches don't open, when markets are not open, it's an avenue for people to get to ask questions and they get to know that there is such a disease around. Now, this is the time for governments, for everybody involved in this to drive awareness campaigns. That's number one. Number two is for them to strategize and to make sure that the health facilities, the institutions are strengthened enough and ready for, for the outbreak, because we are going to see more cases coming up as more tests are being carried out. So the hospitals need to be ready. More ventilators should be available. More treatment centers should be available. The lockdown is such that we need it to suppress the spread. But at this initial time, it shouldn't be something I see forever, right? So as we suppress the spread, the government and every person responsible, in managing this situation should, at this time, try to make sure that every strategy is put in place in preparation for whatever spread and whatever magnitude of the spread that is going to follow.
Amazing. Thank you, Dr. Obichi. And Dr. Saberi, your perspective as well.
There is no way.
Sorry, Obichi, you cut out there. I thought you were finished.
Okay, sorry. I just wanted to just mention this. There is no way we can lock down an economy that has more than 50% of the population living by the day. So, and there is no way to give them any incentives. There's no way to give them palliatives. There's no way to support them in any way, because they don't have their data. They don't have bank accounts. You can't reach out to them. No welfare system. There is just way to do that. So what happens is that these guys will go ahead to getting involved in crimes. You have social unrest every day. In fact, in Lagos now, you have some of the young people writing letters to households that they're going to come to attack them. They give you the day they're going to come to attack you, so that you should get prepared to give them something. It has gone crazy. It's up to that. So you find out that people are dying, losing their lives carelessly from stray bullets. People will say it's better that I die from COVID-19 than from hunger or from stray bullets. All right. So these are very complicated issues, and I think that the government should be more sensitive, to the plight of persons that cannot survive from a lockdown of more than 2 weeks and 3 weeks.
That's such a powerful statement. I mean, the fact that people would be willing to say, I'd rather die from COVID-19 than from stray bullets or from hunger. I think it's a vastly different perspective that you have to take when focusing, it sounds like, when focusing on Africa, where the government can't send stimulus checks to every citizen because, as you said, the data doesn't exist. And when people panic and start rioting, like what happens in Lagos, your chances of dying from a gunshot are much stronger than your chances from dying from a virus. So it's a vastly different reality, it sounds like, Obichi, that you're facing on the ground than what we're facing here in the United States. I'm very grateful for you for sharing that. Dr. Saberi, your thoughts, if you can make them brief, on the same question, and specifically in Burkina Faso.
Okay, thank you again, Justin. Lockdown is very difficult right now, Burkina Faso is not in complete lockdown. They are just restriction. Some cities are under curfew, but it's very, very difficult because like these are like tough leadership decisions that government have to make because they have to balance like the advantages and the disadvantages of going through like closure of markets, whatever, complete lockdown, because we have fragile economies. And Dr. Bishi was mentioning that it's very difficult. People are living on a daily basis. So if they don't work today, they don't get something to eat. And it's very, very difficult. So deciding for a lockdown means like that the government has to provide sustainable solution during this, like to feed the population during this period. And unfortunately, we don't have this money for that. We don't have the money for that. So recently, the market, for example, the big market of Ouagadougou, the main capital, was reopened. So the market was closed and recently reopened just because of the social pressure. People were complaining because like there were governmental measures like to smooth the process, but it's difficult for people like to find something to eat, to find money to buy food. So they had to reopen. And Dr. Bishi was saying that this is an opportunity for us to raise awareness about the disease so that when everything is reopened, people maintain the physical distancing and the hygiene, the uh, basic hygiene and sanitation things. So it's very, very important that we emphasize on communication during this period and also, thank you.
Justin, if you might just disagree a little bit.
Yes, that's perfect.
Well, I understand what Dr. Bishi was saying about the fact that the lockdown in Africa might not work because it has a huge toll as well, and also to focus on the awareness part. And that's an important piece. We need to focus on the awareness part, and we need to mobilize our resources as African countries to direct it towards giving the right information to the public. But you know, we are at a race of a time. Every day, we see lots of cases in our countries. It's given at the very early stage of this pandemic that each infected person will infect between 2 to 3 around him. And then we will go in an escalation process that makes the number in a country like, let us say that just US, tripled or doubled every 3 days, which is a huge number. So we are running against the time in the case of COVID-19. If it takes you time to mobilize your resources and create the right messages and send them and create the awareness landscape that you're looking for, I don't think the COVID-19 would be the best scenario for that. And I'm saying that because we do have a one bright spot in this pandemic in Vietnam. Vietnam is a country of 95 million individuals that are sharing borders with China, the hottest spot of this pandemic. You know what happened in them? In the very first days, they put the country into a lockdown. They don't have one single death in Vietnam up to yesterday. I don't know what happened today. And they do have less than maybe 400 cases positive. That's a unique situation. Why they were, it's a developing country. It's not even a Western country. It's not a developed country. It's a huge country that has people with lots of burdens in it. But the government put these tight restrictions. It's something could hardly be done in a Western country or a country that has some sort of democratic process. And this will bring this burning question. Would it be really effective to apply restrictive measures in countries that are under dictatorship or under some sort of restrictive regime? I know this is a political question, but in fact, it does work if you are running against a time. It worked, we've seen it work in China somehow. We've seen it worked in Korea as well. Despite, you know, this claims and allegation that the government is not reflecting the right numbers or so. But we've seen it working very well in Vietnam. And I was just looking at the news saying that it's starting yesterday or today, maybe Vietnam is loosening its restrictive measures and allowing some sort of small gathering. But they are still in lockdown, like they're not completely locked down, but they're still, their airport is closed and their borders are closed as well. But they don't have one single death due to COVID-19. This is a very successful story. What we need in Africa is to follow restrictive measures. We are really good at doing that because the nature, there is no huge pushback. If you can use your available resources to apply restrictive measures, that could be the best way to approach the COVID-19. You can still keep the awareness tracks going on, but you cannot rely on them completely. And let me just bring to the point, I saw a question from a guy here, and could be the right time to answer that. He was asking about alternatives to social distancing. He was mentioning Sudan in particular. Well, honestly, the short answer to that is there is no alternative to social distancing when it comes to COVID-19. The only alternative would be to follow the herd immunity. We've heard that when the British were talking about it, when one of the officials were talking about the fact that, well, let us apply less restrictive measures, get lots of people infected in a very narrow window of time. We pay the toll, but we get, at the end of the day, we will have lots of people being exposed to that disease and being immunized, which is called the herd immunity. But this is not going to work in Africa. And it's not going to work anywhere else. It's actually, I look at it as an unethical approach to put lots of people at risk in order to create some sort of immunity for the rest of the population. Because in many cases, the death toll of this approach is really huge, and it is preventable. There was like one of the curve that was widely circulated, and I have it here on my computer. I'm not sure if it's going to be clear or not. The red one is for the number of infections over time, and the blue one is when you have restrictive measures. So if you are going to end up having, let us say, 3,000 individuals infected, it is different when you have those 3,000 infected in 1 week, because that means they're going to consume all the resources they have. You're not going to find beds in hospitals for them. You're not going to find beds for others who are sick and need the intensive cares. At the same time, if you allow the restrictive measures, you'll have the same number of people, but over a longer period of time, which gives you a chance to renew your capacity, to add more resources, to mobilize more resources, and also to give a chance for those sick people to recover and then to get out, to be discharged out of the hospital and have another space for the others who are coming. So I just wanted to explain this to you before we move forward. Thank you.
Amazing. Thank you, Dr. Shaza. And I love the fact that there is disagreement amongst specialists and experts. I think that's so important, and it just demonstrates the level of complexity here that we're facing. There's not one solution that fits all. We have about 7 minutes left, and so what I want to do is I want to give each of you 2 minutes. I'm going to summarize the final questions that were available, that were posted, and give you guys 2 minutes to answer these final questions as best of your ability. And I'll try to keep you all to 2 minutes. So the questions left, one has to do with misinformation, specifically around countries like Israel being blamed for the crisis. And I know Dr. Abichi and Dr. Saberi, you might be in a good position to answer that since you both studied in Israel. Another question that we had submitted was around women in this crisis. Do women face different circumstances than men? And I guess finally, I'll ask for any remaining innovative options or your hopes. Leave us on a hopeful note here. So we'll go Abichi, Saberi, and we'll conclude with Shaza.
Okay, thank you so much, Justin. I didn't quite get the question on misinformation in Israel.
The question was, yeah, the questioner asked that they had seen in posts that the country of Israel was being accused of manufacturing or being a part of spreading the virus as one example of misinformation. And if you could talk to that, that would be great, as well as give us your innovative and hopeful solutions.
Okay. All right. So very briefly, I don't think I agree to that, of course, because there's this whole lot of information on social media flying around. Israel have kind of tracked the progress Israel has made over over this period of COVID-19 and all of that. I think it's actually impressive. They're trying to, relax the restrictive orders, the lockdown and all of that. And I see the officials, I've watched clips of the officials talking to the masses every now and again, trying to inform them of the development and what they have to do, in this period. And I have a number of my colleagues leaving the travel from Nigeria back to Israel, and we've been actually interacting. So I don't think that it's been a case of misinformation coming from Israel or from Israel to its citizens, so far from my observation. So then about innovations in COVID-19, I'll be very quick about this. So I run a platform where I gather some of the young professionals, smart young professionals across Nigeria and Ghana, and they develop solutions and innovations to challenges. In the next week, we're starting another batch of the fellowship where 120 young professionals in Nigeria have been gathered to come and develop, solutions around COVID-19, frugal innovations. And I'm going to talk about the categories of innovations you could find in around COVID-19. First is that there are the direct innovations and there are indirect innovations. So direct innovations are the ones that directly affect COVID-19 prevention, while indirect are the ones that affect the ripple effect, the collateral damages it's going to cause, like in education, in healthcare, and all of that. So in the direct innovations, we're looking at lifestyle behavioral changes innovations. So we have things like, apps are able to track how many times you wash your hand, and you and your community have washed your hands, and have some kind of challenge and reward systems where you also have to talk to personalities and all of that based on who emerged, the winners and all of that. So it's a kind of encouragement, for persons to change their habits. Then you have a kind of door opener, automatic door opener. So with this attached to doors, it could open on its own without you. So it's an IoT kind of thing. Persons are able to open up doors without. Then you have another interesting one, which is a kind of a big tank, that is able to produce water for hand washing, and this is supposed to be in marketplaces. So this is a container, a big, basin in a container that is solar powered. So there are two types. There is the solar powered, container that is able to produce water for hand washing and soap as well. So this is supposed to be put in strategic, places, public places for hand washing. We have the designer face mask, competition challenge that is coming up now, so that people were going to see wearing face masks as a, part of costume, part of, dress.
All right, we lost Obichi for a second here, but I'm going to say those are phenomenal options, and I know we have a number of my peers from Harvard that are working on proposals right now to the WHO and other organizations, and so maybe incorporate some of those ideas into proposals. Obichi, we lost you. We lost you at the end there, and I got to turn it over to Saberi and Shaza to conclude. But the ideas were phenomenal. Thank you, Dr. Saberi.
Yeah. Okay, thank you very much, Justin. So talking about Israel, I'm not very aware of this misinformation. I would rather say that Israel is known as the startup country. So there's a lot of innovation, a lot of innovative people, young people there working on finding solutions like at a low cost. And we are currently working on finding ventilators at a low cost in this country. So talking about technology and innovation in Burkina Faso, so I will give the example of a young architect who is currently proposing to build like a health facility using local materials just in 21 days. And this action resulted from a decision of the government to manage, like to rent the hotels, like to manage some of the COVID-19 cases there. And this was not a sustainable solution. And this young architect decided he designed some plans and everything with his team. and said, we can do it. And the proposition is currently discussed and it's promising. There's also many young innovators who are working on finding, on designing ventilators that will work, that will be accurate, reliable, and that can be used everywhere. There are also numerous examples of detection, COVID-19 detection platform used to slow down, like to not overflow the health facilities. So there are many, many, many innovative solutions that are provided by young people on the ground. And yeah, thank you.
Thank you, Dr. Saberi, for your work. I'll also mention, I know you mentioned it, Dr. Saberi is an alum of the Amel Institute, and we're really proud that you are. So thank you. And Dr. Shaza, you'll have the last word.
Yeah, how this COVID-19 affecting women. The good thing about it, less women are affected compared to men. The death among women is less, the infection rate among women is less. And though there are so many theories, I'm not gonna go through those theories right now, but those theories range from behaviors to the structure, the gender kind of hierarchy in the communities, which puts men at more risk than women, to other things related to the fact that women are more attached to the hygienic behaviors than men, due to the fact that they're most of the time they're just working at home, washing dishes, doing things. So eventually they do that. But the downside of that is that in these restrictive measures going around the world, women are affected by the gender-based violence and domestic violence. We've seen rising numbers in these directions, and this is a bad thing about that. Also, the reproductive health side, we've seen women, pregnant women, having less accessibility in restrictive measures for maternity follow-up and for kind of healthy deliverables, especially in developing countries where most of the hospitals are either affected by coronavirus or the resources are kind of limited. The last thing in terms of innovations, I'm so proud of the Africans and other parts of innovators around the world who are innovating new apps to help the health workers, new cashless tools to minimize circulating cash during this pandemic. Also, some of them are creating some sort of innovative webs where innovators comes together. Some of them are raising funds for COVID-19 in a very, even the platforms where you just go there and submit your information and figure out whether you need to be tested or not. These are very popular kind of message to minimize going to hospital or asking physicians. Telemedicine, e-medicine, so on and so forth. Lots of ways to approach it in a very innovative way. Finally, I just want to say, this is a great lesson for the entire world. It's a great time for the earth, for the climate, for the pollution to go down. You know, I'm just looking at the bright side, and we said, let us look at it. Yes, this is the first time to see tremendous effect from the people getting into their home and not going outside. And I'm so glad to see that. That means if we've done restrictive measure that is environmental friendly, is gonna work in the future. Thank you.
Well, this is incredible, you guys. Thank you all, and thank you everyone for staying a few minutes extra. Shaza, I love that note to end on. I think if we can all come together in this crisis, we'll be able to solve a lot of other challenges that the world faces as well. Obviously, we'll never have enough time as necessary to discuss all of the aspects of this, but we look forward to seeing you all on the next panel soon. Stay safe, stay healthy, and thank you all.
Thank you, Justin. Thanks.
Bye, everyone.
Thank you.